Coming up today on Your Sastastic Life, we welcome Dr. Courtney Buhrow. Courtney graduated from Des Moines University in 2018 with her doctorate in physical therapy. She worked in multiple settings and eventually went on to open her own business in January 22. Revise Physical Therapy and Wellness. After her own journey with pregnancy and postpartum recovery, she realized there was something missing in the healthcare setting to really address the whole person, especially those going through postpartum recovery. Thus, sprung the mission that Dr. Courtney and her team are on to educate and help women find the root cause and have healing results in a more holistic, full body approach. Buckle up, here comes the sass.
Your Sastastic Life with hosts Trisha Rivas and Wendy Fredrigel.
Hello! We are super excited to have Courtney Buhrow in the hot seat.
Yeah, excited to be here. Thank you.
It's so nicely coordinated.
Yes.
I was told not to wear purple, so I went with a different color. today.
Yes.
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 Good idea.
So you wouldn't
Good
blend
idea.
into the
I
wall.
don't want to be one with wall. So, thank you.
Awesome.
Well, oh my gosh, there's so many reasons we're excited to have a young whippersnapper on the show with us.
Yes.
So that's great.
Yes.
But you're also a business owner,
Mhm.
which is amazing because it takes a lot of courage
Mm.
and cojones
cojones,
and
big ones.
and
No, tough vaginas.
tough
Tough
vaginas
vaginas.
to be
Yes.
a business owner.
Those two.
Tough vaginas.
Gritty.
Yes.
Gritty.
But also you are here for women's health and men's health,
Mhm.
Yes.
all about the pelvic floor,
Yes, we all have them, men
Mhm.
and women.
right?
Yeah.
We all have a pelvis.
Yes, we do.
So we're going to be talking about that. We're going to be talking about some traumatic birth situations and how that can affect
All the things.
All the things.
Yes.
All the things.
Yes.
Yes.
All the things down below.
Down under.
Down under. Yes.
So we laugh because you will talk about vaginas anywhere, anytime, any place.
Anytime. I love it. I'll shout it from the rooftops. They need
Yeah.
to be talked about.
Yes.
People don't want to talk about it, but it needs to be talked about because they're with us for our whole life
Mhm.
and they do a lot of things for us. So
Yeah.
I think the biggest thing is just understanding one, sometimes people don't even know where the pelvic floor, where it is, what it does. So basically, just for a brief understanding, it's the muscle that runs between the pubic bone in the front and the tailbone in the back, and really just kind of holds everything up throughout the entire pelvic region and the cavity of the trunk and everything like that. But it's very important for urinary, bowel, sexual function. It can be related to back pain, hip pain, leg pain, all the things. So it's a really important muscle that is not talked about enough. We joke about it being the vagina, but really it's that whole area down there. It's important for orgasms and, like I said, sexual health. If we're having pain or anything like that. A big one is pants peeing and how commonized that is now or normalized that is. And it is common, but it doesn't have to be the new normal, right? And just really understanding what that muscle does for us for our function is so important, and it regulates so many things. And I don't think people understand that as much. And to their defense, education hasn't come out a lot about it,
Yeah.
especially for women in their 40s and their 50s and 60s and beyond. It definitely was never really talked about. It's really becoming big in the last 10 years. And especially in the last couple of years, it's really booming to understand, but there's still so much education to be had around it. And so many, I don't know the word I want to use for this, but there's just so many things that have been normalized from generations
Yeah.
that we have to break those generational cycles around it.
Yeah.
And that's really what we're passionate about too, is just really educating people around, like, just because that was normal back then, quote unquote, does not mean it or it was common, does not mean it should be normal.
Mhm.
And you don't have to live with it.
Could you give us an example of what maybe one of those um, situations would have been? And what I mean by that, like for my grandma.
Yeah.
And what would have a situation like, oh my goodness, very taboo. We don't talk about that. Just like we don't talk about our periods. We're not going to talk about, peeing our pants. Is that,
Yeah, and I would say one big thing that's been, like, passed down, we hear it all the time, like, "Oh, you've had babies, you're just gonna pee your pants."
Oh,
That's just the
yep.
normal. Like, I did that, I'm still doing
Mhm.
that. It's like, "Honey, you're 80 years old. Like, we don't need to be peeing our pants," you know? And, like,
Yes.
you're sitting over here being 20 in your late 20s, early 30s thinking, "Am I gonna pee my pants every day for the next 50
Mm,
years?" Like, that's not
mm,
normal, right? That's
mhm.
not that doesn't need to be your new norm. But there are a lot of things that are not talked about
Yeah.
generationally, sex being a huge thing.
Oh, yeah.
And we see
Yeah.
that a lot. And I know we can probably get into this too, but a lot of trauma stored up into it. We're seeing more and more sex shaming and how it was never talked about. And then people go on and they get married and now they're having painful sex. And now they know that other people know that they're having sex. And that is so shame provoking.
Mhm.
Um, and then on top of that, they're having pain
Yeah.
and nobody's talking about that and they feel scared to bring that up. Like, again, they think, oh, this is just normal. I have never had sex before. This is just painful, you know, and those kind of things. And now we're not having orgasms. Well, why would I talk to anybody about an orgasm?
Yeah.
We're getting brought up in a sex shaming culture. Not everybody, but
Yeah.
um it's kind of, I hate to say this, but religious circles, there's a
Mhm.
big, and I grew up in a religious circle. I grew up in the, it wasn't necessarily meant to be shameful,
Mhm.
but it was just like, don't have sex till you're married, don't masturbate,
Sure.
don't do self-pleasure, don't do those kind of things. And so it becomes very taboo. It
Yeah.
becomes very much like, oh, I shouldn't touch myself. Like, why would I want to do that? Like, why would I work on that? And it really doesn't have to be shame filled. It is our body. We should know, and as women, we should know what makes us feel pleasurable. We're created for
Yeah.
pleasure, right? That's what I would say the biggest thing is for
Yeah.
generational.
That's a great example.
And
Yeah.
if you think
Great
about it, if
example.
there's shame or pain, what are you going to be doing? You're going to be bracing.
Yes,
Oh my gosh, yeah.
So it's hard to loosen up when you have all
totally.
that going on.
And
Mhm.
then once you have pain once, you anticipate that you're gonna have pain again. And so your tightness becomes sooner and sooner in the process.
Yeah.
And so to be able to break that cycle in your own head and your own body can be extremely difficult.
Mhm.
And yes, there's physical pain, but there's a lot of mental and emotional pain wrapped up in that as well that comes out as physical pain.
Yeah.
And not everybody realizes how much that's connected.
Mhm.
Yeah.
So,
Mhm.
yeah.
Yeah.
I think it's great too, just how much more menopause is being talked about because there
Yeah.
was not a lot of research or discussion about menopause. So all of this.
Yeah,
Mhm.
slowly coming, which is great. And I think too, I think there's just a lot of providers now breaking out into that
Yeah.
and really breaking off into their own clinic, giving them more time to research it and
Yeah.
to understand it and to take on different non-pharmaceutical ways to really
Mhm.
help women,
Mhm.
which is amazing. But it's just, I think in general, women's health is just so underserved, so underknown and researched. And so I think that makes things really difficult as well. But I also think I'm huge on understanding how stress and mental and emotional and physical health all play into menopause and how you're feeling and those kind of things. And if we're stressed all the time and we're in this stage as we get older of working moms and trying to have a career and trying to raise kids through all stages of life. I mean, that puts a lot of stress. That
Yeah.
changes your body a lot. And then we're not talking about painful sex and we're not talking about how to pleasure yourself and get that kind of release. There's so much that goes into it for sure.
Yeah.
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 I want to take a minute to talk about the pants peeing thing.
Yeah. Hit me.
So I don't like my sister's sons, they have a trampoline.
Okay.
So she jokes she can't go on the trampoline anymore,
Yeah.
you know, things like that. So I don't notice that. Like when
Okay.
I'm working out, I
Mhm.
don't feel like I notice it. I feel like I have just like a slow leak.
Mm.
Like at all times.
I don't feel it come out.
Mm.
Yeah.
I'll just go to the bathroom. I'm like, my underwear is wet.
Wet. Hmm.
Yeah.
Hmm.
So is there a difference between the two of just not being able to hold it when you're jumping versus a slow leak? Is that a different
That's not you taking
problem?
care of your STD, Wendy.
I don't have an STD.
Does
There's a
it have a
cream for
smell to it? I
that.
mean, have you smelled it yet?
There's a
Like,
cream for that.
It
yeah.
just smells like it's like I smell like a nursing home. Like it smells like
You need those Depends that wick away the
yes,
moisture and the
yes.
smell.
So then I was thinking, I don't want to keep relying on poise pads because it makes me
Totally.
think about when you're potty training your kids.
Totally.
And when
Yes.
you have to take away the pull-ups because they need to be able to feel
Yeah.
that they peed.
Yes.
And so I'm
Yes.
like, I can't wear pull-ups. I can't wear adult
No.
pull-ups. Get
Yes.
Oh.
Absolutely.
Is there a difference between the two, just not being able to hold it when you're jumping or running versus like that slow drip?
Yeah, a little there's a few different things. So like jumping, running, anything kind of high intensity, we add a pressure component.
Right.
And what I mean by that is a lot of times if we're lifting heavy or something like that, usually people tend to hold their breath. We create a lot of downward pressure into the pelvic cavity,
Yeah.
releases that muscle. And then we release some urine. Same thing with jumping and those kind of things. The daily like activity, what we typically see is one, if they're not feeling it, we're going to be looking a little bit at like the nerves and are we having a sensory situation? Do we need to make sure that we can feel the urge and those kind of things?
Mhm.
But a lot of that has to do with more of the endurance, I would say, because it's like throughout the day, it's not those big explosive things. Um, and so you might not feel it, but it could be when you go from sit to stand. It could
Yeah.
be when you're reaching quickly to grab something or something like that, where it's like we're distracted by other things. And so we're not necessarily feeling it, but it happens.
Yeah.
Not a sensory problem. It's just our brain is elsewhere. We're not thinking, is something coming out of my vagina right now,
Mm,
you
Yeah.
know? But then I would more so want to look at what's happening with the muscle, the pelvic floor muscles when we're in that upright position, when we're going from sit to stand, those kind of things. So
Yeah.
yeah, same ish, but different kind of muscle. Like, is it a strength? Is it an endurance kind of thing?
Yeah.
hmm Yep.
Well, we like to talk about hard shit on our show.
Yeah.
And so I think it'd be really helpful. I think a lot of women would relate to this that have gone through this.
Mhm.
So tell us a little about, well, you had your daughter,
Yep.
and that sounds like that was all normal, vaginal birth, boom,
Yeah. Vaginal, normal, quote unquote.
right?
Birth. Yep.
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 Then you're pregnant with your second one.
Yep. My daughter was 2. Yep. You want me just to kind of tell you the story?
Yeah.
Mhm.
Yeah. So I was pregnant with my son in 2020. We found out, gosh, it would have been probably November 2021 that we would have, no, a little bit later, February. We were due in November 2020. So we found out right before COVID hit. And obviously very unknown what was going to happen. I ended up getting COVID in May. Nothing crazy, which was good. But where I was going for my doctor at the time, their protocol for COVID moms
Mhm.
was non-stress test for the last 8 weeks, every week for the last 8 weeks. I think their concern was that the placenta was going to give out. They wanted to be ahead of it, just being very cautious, which I was okay with, especially not knowing what this meant at the time. And so I went in for my 36-week appointment, and this would have been like my fourth non-stress test. But again, it was COVID, so I had to drop my daughter off at my aunt and uncle's. My husband was working from home. You couldn't bring anybody with you. You had to go by yourself, which again, I was mostly okay with. Second kid, felt pretty confident in it. And they did the non-stress test, and the doctor at the time was just like, I don't really love what I see. We didn't know it was a he at the time, but I'll just use that for the story. He was not responding super well to contractions. So they were just like, I want you to go over to the hospital. I want you to get a biophysical profile, which basically it's an ultrasound, but not an anatomy screen. It's more looking at fluid, amniotic fluid, practice breast, and a few other things I can't quite remember. And then they take the non-stress test into consideration as well. And so I went over, they hooked me up to monitors, they brought in a radiology person tech to do the ultrasound, and they didn't tell me anything. They didn't tell me what they were looking for. They didn't tell me any of those things. They were just like, we're just going to do this. So I just laid there and I was like, okay, like, I wish I probably would have known back then, but at the same time, like, I would have, it was fine. It
Yeah.
what it is. And so what happened though at the end, they were done, they wrapped it up, and I asked them what it meant. Like I asked them what the results were, and they're like, "Well, we can't tell you that. We have to tell the doctor first." And then I looked at the nurse, and these 2 were walking out of the room at the time, like, at the same time. So then I looked at the nurse, and I was like, "Well, what does this, like, mean?" She's like, "It probably just means that you're gonna have your baby today." And I was like, "Okay, like, you're gonna induce me, I'm gonna labor, I'm gonna, like, go through the whole thing. I can get on board with that." And so they left the room to go find the doctor.
Mhm.
And 2 to 3 minutes later, 3 new nurses and an anesthesiologist came walking in, and they looked at me, they're like, "Okay, we're gonna get you prepped." And I was like, "For what?" Like, "What are you prepping me for?" They're like, "Didn't they tell you you're gonna have a C-section today? We need to, like, go. We need to get you ready."
Oh,
And I
Courtney.
was like, "Yeah," and I just looked at him, I was like, "I don't think so." Like, "Are you sure?"
This isn't in
Like,
my birthing plan.
Yeah, "This is not my birth plan, like, isn't there any other option?" I was like, "Can't you guys just, like, break my water and let me labor?" And they're like, "No, you're only dilated a centimeter, we need to get him out, and we need to get him out stat." And I
But
was
they
like,
have still not explained any of this.
and I said, "Okay, so how did we get to this
Yeah.
point?" And they're like, "Well, you scored a 2 out of 8 on your biophysical profile, and then he wasn't responding well to, your contractions, and, so we need to go stat." And I was like, "I had not even talked to a doctor, like, not that I don't trust you as the nurse,
Yeah.
but, like,
Yeah.
can we talk about my options? Like,
Yeah.
I feel like you're not giving me any options." Not to mention, my daughter is with my aunt and my husband's at home working. And
Yeah.
I told him, I was like, I think we're fine. I don't think you need to come. And so this was 11:37. I like these are the weird details I just really remember.
Yeah.
And I was like, okay, I need to call my mom. My mom lives 2 hours away. I need her to come get my daughter. Not that my aunt couldn't handle her, but I knew this was gonna be for the long haul, and then I need to call my husband, and so my husband, I called him, he got coming right away, he called my aunt, I called my mom, and then I changed into the gown while I was doing it because 'cause they're like, "We need you to get going, we have to COVID test you," and I'm like, "Super, that's super important right now," you know?
Mm.
So doing all these things that we had to do before we went, and then I also asked who the doctor was, and it was my least favorite doctor on call, and I was like, "If I don't have any control over anything else, I am choosing my doctor." And the nurse told me, like, "I think you're gonna be fine, like, the doctor who sent you over, trust this doctor." I was like, "No. Who's my on-call doctor? I want that person." And they told me, and I was like, "I'm gonna refuse the first doctor." And she was like, "You have every right."
I
1
did
minute
not know
later,
that.
yeah, 1 minute later, she came walking in, the doctor I did not want, and my I looked at the nurse, and the nurse grabbed her and took her out in the hallway, and a new doctor came in. So, very thankful for that, that I could advocate for myself and that
Mhm.
they would listen to me because I
Thank
was
goodness.
yeah, I was pissed. I was
Yeah.
so mad.
Yeah.
And so then they wheeled me into the OR and got me all set up and transferred me over. And my son was that start all started at 11:37. My son was born at 12:30.
Mm.
So it was all in less than an hour, and through the whole process, laying on the table, for the C-section, my body was just so tight. I
Yeah.
was so anxious. I had no idea what was happening. I couldn't relax my body. I looked at the anesthesiologist and I said, "Give me whatever you got." Like, calm my body down. I'm pretty sure I went numb up to the shoulders, because I just needed
Yeah.
to just relax. So yeah, whirlwind, super fast. And then again, COVID. So my daughter couldn't come up to the hospital. And so she got picked up by my mom from my aunt, and that was Friday. And we didn't return home till Monday. And so it was extremely difficult for
Yeah.
everybody and just this whole whirlwind of everything. But um, my son was born and he was healthy and a little bit of mishap, like with he needed some oxygen, needed some blood sugar help. But after about the first 4 to 8 hours, he was pretty good.
Yeah.
So we're happy and thankful about that. But it definitely doesn't negate the experience and the
Yeah.
whirlwind that we went through. So,
Did you experience postpartum depression
um,
with that experience?
I wouldn't necessarily say that I had like PPD or anything like that. I had a lot of anxiety though.
Yeah.
I
Yeah.
definitely I didn't have a hard time like finding joy or
Yeah.
anything like
Yeah.
that. I was very happy, but
Yeah.
it was extremely difficult. I mean, my daughter was 2. I had lifting restrictions.
Yeah.
I mean, I kind of told the doctor when I left, I was like, I have a 2-year-old and she's going to need me
Yeah.
and I'm going to do what I need to do. And he kind of agreed with that. He was like, I get it. Like,
Mm.
you need to do what you need to do. But I it was very hard on her. She has very big emotions. She's very intuitive with those kind of
Yeah.
things. And so I know that whole thing was super hard. And now we had this newborn, and now I have this abdominal scar, and it feels weird to even have like underwear or shorts on it. And just like the unknown of how long this was going to take me to recover my body, and just being pissed, if
Yeah.
I'm honest.
Yeah.
Just like so mad that it went this way. How could we have done things differently? How could we have avoided that? And just tried to play the scenario through my head over and
Mhm.
over and over again to figure out a different way. Obviously, I was very happy that my son was healthy,
Yes.
but they found nothing.
Yeah.
My placenta was healthy, my uterus was healthy. The only thing they could think of was the umbilical cord was wrapped around his wrist.
Mm.
And so every time he moved, then maybe it depleted oxygen. Um, but still, even that, I'm just like, seriously, what? Like,
Like all of that
yeah,
for
You still don't have answers.
still don't have answers.
Yeah.
Yeah. And so that's been probably the most frustrating piece of
Sure.
it, but I've just had to let it go
Yeah.
and just be
Yeah.
again, I can still be pissed, but still be thankful that there was a reason that I had COVID and I had non-stress tests, because what
Mhm.
if, like
Mhm.
I kind of always played that game too. Like,
Yes.
what if I didn't have COVID? What if I didn't have these non-stress tests? Would we have caught this? Could it have ended in a fluke stillborn? I don't know. And I
Mhm.
don't really want to go down that road either. And
No.
so,
Yeah.
um, but I was telling Wendy before this, I feel like it's really shaped who I am as a provider.
Yes. I was just gonna
And
ask that.
I am a person of faith, and just really holding on to the fact that it was meant for a
Yeah.
reason. And I get to meet women in a different place than I was able to before.
yes.
And just really understanding when something is completely out of your control, something goes completely awry of
Yeah.
what you've been expecting,
Yeah.
it's okay.
Yeah.
Like, you're still going to be okay,
Yeah.
and it's okay to have the feelings that you have.
Yeah.
And I um sorry, I'm feel like I'm rambling, but I'm very passionate about
No,
this because
no,
this is a
you're not.
huge piece too of like what we do in the office with our
Yes.
women is that they come in and they've had this traumatic experience, and their baby's okay, and everyone is telling them, just be thankful that your baby's here and healthy. It's okay that baby's here and healthy, but
Yeah.
you're still freaking pissed,
Yeah.
and that you're sad, and that you feel shame because you feel
Yeah.
like your body couldn't do what it was supposed to, or what you thought it should do,
Mhm.
or what culture says that it should be. And
Yes.
you feel mad and upset. And now you have this whole different recovery
Yeah.
of whether it's a C-section or vaginal, you had to use an epidural or forceps or
Mhm.
whatever,
Mhm.
you still can have both things. It's not
Yes.
either or. It's not, I feel happy my baby's here and that's it.
Mm.
It can be, I feel happy my baby is here and safe and healthy, and
Mhm.
I had a traumatic experience.
Yeah.
And sometimes, you know what? Moms sit in our office and tell us, I don't like my kid.
Yeah.
And that is fucking hard,
Yeah.
right? Like,
Yeah.
that
Yeah.
is so hard to grapple with.
Mhm.
Is everyone tells you it should be the most joyous time,
Yeah.
and you're sitting over here like, I can't even look at her
No.
because it reminds me of the trauma I just went through.
Yep. Exactly.
And that shit's hard.
Mhm.
And so just having the perspective that I have now to be able to sit in that with people
Yeah.
is huge, and I'm so thankful for that.
Yeah.
And we're the first ones to send to refer to mental health for that.
Yes.
But we have to
Yeah.
talk about it.
Oh my gosh. I mean, Courtney, even 10 years ago,
Mhm.
it was it's astonishing to me to think that how much we are talking about it now.
Mhm.
Personally, I feel like when Brooke Shields
Mm.
started talking about her experience with postpartum depression and her having those intrusive thoughts of
Yeah.
literally wanting to throw her baby out the window.
Yes.
And
Yes.
she wrote a whole book about it.
Yes.
That's not that long ago.
No.
I mean, women were killing themselves, killing their children,
Yes.
being put in psychiatric wards because of a chemical deficiency
Yes.
Yeah.
that
Totally.
of what has happened to their body with bringing life into the world.
Totally.
It's fucked up.
It's so fucked up. It's so this system is so fucked
It
up.
is.
It
Yes.
is so backwards, and there's not enough understanding.
No.
And
No.
I feel like there is
I do wanna say something
yeah.
real quick before I forget though too, honey, is that men can also experience postpartum depression,
Yes.
and we need to talk about that more also.
Totally.
Mhm.
Yes.
We do.
It changes it changes
Yes.
for
It
everybody.
does.
Yeah.
I mean,
Yes.
I even remember before my daughter was born, the last 6 weeks leading up to it, like, my husband was in a huge funk,
Mhm.
and he wouldn't mind me sharing this, but it was just like, he wanted to work out, but he was like, "What do I do? How do I start something new when I don't even know what's coming?"
Yeah.
Like, I don't even know what our life is gonna look like in
Yeah.
6 weeks, like, why would I start now? And it's just, like, trying to figure out who you are
Yeah.
and what your role is, and then you bring in this life,
Yeah.
and now it's like a lot of times the dad works and the mom stays home, and how
Yeah.
much pressure that is. Now we have another mouth to feed. Now we
Yeah.
have more diapers and we have
Yes.
all these expenses and I'm
Yeah.
the only one working.
Mhm.
And or we have 2 working parents,
Yeah.
you know,
Yeah.
and how much more stressful that is. I mean, we both my husband and I both took on different roles and we
Yeah.
still have different roles 4 and 6 years later, you know?
Yeah.
And I think it's so important to understand what that does to people and health in general. When people's health changes,
Yes.
what that does to both counterparts, and what that does to the people around you,
Yeah.
and how much trauma it can bring, you
Yeah.
know? So
And I appreciate though that we're becoming hopefully even more at a place and time where we're not just throwing medicine at it.
yes. Yes.
And I agree in both.
Yes.
Okay, I do, but I also agree the body is very, very powerful and it
Totally.
can heal itself
Absolutely.
if we are given education
Yep.
and have support
Yep.
by people like you
Yep.
and your other practitioners.
Yes.
And a lot of people don't know that still, though.
Yes.
They don't.
It's so tough and it's few and far between.
Mhm.
But no, I agree. And there's a time and place for medication. And
Yes.
especially if you're in a really
Yes.
dark place, that medication can help take the edge off so you can work on the other
Oh my gosh,
things.
it saved my life with
Yes.
Marley.
Yes.
It did. It saved my life with Marley.
Yeah.
Mhm.
Because it gives you enough to be a little bit more clear so
Yes.
that you can focus on your body. You can focus on your mind in a more clear and healthy way
Yeah.
rather than just trying to battle all of it and be like, I can't do medication. But also, we can't just throw medication at it
Yep.
and be like, you're going to be good to go. And like
Yeah.
in 4 to 6 weeks, it will kick in and you'll be fine. And
Yeah.
it's like, it's the same thing with a 6 week postpartum visit. Oh, you're good. You're done bleeding. Go
Yeah.
ahead and go work out, do your
Yeah.
thing. And
Yeah.
that makes more problems down the road for people.
Mm,
Absolutely. So,
mhm.
yeah,
Yeah.
it's big
My
time.
goodness. Again, it could be probably be a 3-part series.
There's so much to talk about with women's health. It's not just having
It is.
babies. I
No,
mean,
it's not.
because people experience this with or
Mhm.
without kids. People can have pants peeing,
Yeah.
constipation, pelvic pain,
Yeah.
painful sex
Mhm.
without having kids. We have so many people in our office that
Mhm.
have that and they haven't even
Yeah.
had kids. And
Yeah.
it's
Yeah.
it's like we can't forget that everyone still has a pelvis,
Yeah.
whether they've had kids or not.
Mhm.
Same thing for males.
I would love to sometime to talk about too the painful sex part
Mm.
because that can be very uncomfortable too.
Oh yeah.
Of course, it's physically uncomfortable, but it can be uncomfortable for your partner.
Totally.
Sometimes it loses the romance of it all. It's like, oh, here, let me put a pillow under your ass, so I can make this comfortable. Or oh, here, lay on your side so we can try that. Or
Yeah.
and it's just like whatever.
It
Just
just
give me my dildo and let me do
yeah.
it myself.
Exactly. It's so true though, and it takes
It
intimacy
is.
out.
It does.
Yes,
It
it becomes like a
does.
chore. It becomes a chore.
Wendy's like, geez Louise, Trisha.
I mean, dildos still. Get your vibrator.
Well, you have them in the
Yeah,
office.
they're great.
Very nice ones.
Yeah, exactly.
But there's a purpose behind them, right?
Yes.
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 So
Yes, yes,
tell us a
yes.
little bit more about that. Like
Yeah.
what those tools do.
The tools, yes. So they're dilators is what we have in the office, and they're different sizes, and we use them for women who don't have either good contraction of their pelvic floor. They need some tactile cueing, and so you can put it's just a long silicone piece, and you can put it into your vaginal opening. You can use it as tactile cueing to engage the pelvic floor muscles. If someone's extremely tight and they're having painful sex, we try to match up the dilator size with an erect penis size of their spouse.
Mhm.
And we have them work on putting that internally themselves,
Yeah.
and make it a safe place. Sometimes we include their partner in that if that's what they choose, because that can be really a safe practice too. Of there is no expectations. We're just inserting this into the vaginal opening, working on accepting something of that size in a safe manner, and then being able to relax the muscles around it. And it
Mhm.
becomes tactile cueing again of here's this silicone piece. We need to relax around it and we need to let things go too.
Yeah.
And so we use that a lot with our clients, or we have them purchase them so they're not reused in the clinic. So we have those, and then we also use pelvic wands a lot when people have a lot of tightness that can cause painful sex or hip pain, back pain, those kind of things. And just a little wand that kind of represents like what our finger does during internal exams and treatments when they're in the office. And then that way they can put it in through their vaginal opening and then find those tight spots in those muscles and be able to release that tissue on their own in between sessions. So those are both super helpful. We do have some dilators for rectals or rectums, because sometimes those can be extremely tight as well.
Mhm.
And just being able to release that tension and bring some stretching and some relaxation. So
So it's like a foam roller for your crotch, sort of. The
I mean,
concept.
kind of, yeah.
You know what I mean? When you're
Yeah.
rolling out on the
You're
foam
rolling out
roller.
muscles and stuff. This just goes in internal, and
Oh, yeah.
yeah, it just gives you some relaxation. And I don't want people to think it's always just the female, but if you're the one that is experiencing that painful sex, there's many things that it could be. And as you go through menopause and those kind of things, we usually tend to need more lubricant, or we need
Yep.
some estrogen cream, or
Yes.
and nothing to be ashamed about that. That's just part of our natural
Mhm.
body. But there are so many things to do. There's so much tissue around your clitoral hood, and
Yeah.
that can tighten up. And when we go through menopause, when we have aging, our muscles change, our skin changes, things move around. And we just need to be aware of it.
Yeah.
There's so many things what we can do that are non-invasive, that are non-permanent, but we can move the skin tissue, we can stretch it, those kind of things. And just being educated on that can you you can take that back and be intimate with your partner.
Yeah.
I mean, we
Mhm.
teach women all the time, like especially with clitoral hood tightness, get your husband to do more foreplay.
Yeah.
Like start there, loosen that up, because then the clitoris is going to feel better.
Mhm.
Yeah.
And the orgasm's going to feel better because now we don't have the hood and the skin trapping it down,
Mhm.
and those things change over time.
Yeah,
Yeah.
because as you lose your estrogen and progesterone,
Yeah,
it
you
kind of
tighten up.
dries up
Yep.
and tightens up.
Your face.
Dries up.
I know.
Like a prune.
I know. Let's
Like
make
a
it,
raisin.
yeah, a little raisin down there.
So I don't remember where I was with you or where this came up, but I would love for you to tell us this because I every time I sit down and go to the bathroom, I think of you telling me that you are not supposed to blow your nose when you're
Yeah.
going to the bathroom.
We had a post
Please
about this.
tell us.
What? I don't ever remember hearing this.
We had a
And I
post
do
about
that
it.
all the time.
I know, it's a time save, right?
Yes.
So when you go to sit on the toilet, everything should be relaxed. So we really are big advocates for using a squatty potty or a step stool, especially if you're
Yeah.
having a bowel movement.
Yeah.
But it's not a bad thing to use when you're urinating either.
Mhm.
But what happens when we blow our nose is we create a lot of downward pressure. Okay, and so just coming back to jumping and the pressure
Mhm.
that we create in that, what we really need to happen is the pelvic floor needs to kind of engage and kind of lift up like an elevator, like you're
Mhm.
slurping a smoothie, okay? Something like that. But when we go to the bathroom, we want our pelvic floor to relax, right? And so when we blow our nose, you should be engaging. So you can see how when you're going to the bathroom, you should be relaxing. But then if you're blowing your nose, now we're having
Oh,
this counter
yeah.
like war here,
Yeah.
right? Or if we're already relaxing and then we blow our nose, we're forcing down into that
Mhm.
relaxed position.
Mhm.
And so it loosens everything. And it puts a lot of pressure, making the pelvic floor have a really hard time knowing how to contract and what to do.
Mm.
And so now we're sending signals to our brain of when I go to the bathroom, should I be tightening? Or when I'm going to the bathroom, I have a lot of pressure. And so now it's just this like discombobulated mess of
Mhm.
what do I do?
Yeah.
And then we're actually more detrimental to the pelvic floor
Mm.
when we're blowing our nose while we're trying to pee, because then we're power peeing,
Yeah. Yeah.
and you shouldn't be power peeing. You should
Like a
not.
horse.
Yes, you should
Like a
not be
racehorse.
forcing down. You should just be sitting on the toilet
Yes.
and allowing it to go. But we see this a lot. Like, I mean, like even in our teachers, they're like, I don't have time to pee. I got to run to the bathroom
Yeah.
and I got to force every last drip out of me.
And I got to
it's
blow
like,
my nose. I got to like
Yeah.
yeah, you got to do all these
multitask
things.
while I pee.
Yeah, and it's like, for heaven's sakes, please protect your pee. Like,
Yes.
sit down, relax, let it come
Yeah.
out. Same with your poop.
Yeah.
Yep.
Just sit and let it come out. So,
Yeah.
yes,
Well, I'm thinking
stop
as
blowing your nose.
hairstylist too. How often would we hold it? I
Oh.
joke, and it's not correct
Oh,
about being a camel.
yes.
Yeah.
I mean, I could
Yes.
hold it for hours if I had to.
Which is like impressive for the most part, but we need to go to the
Yes,
bathroom too, because we don't want your bladder to get distended. We need everything to
Exactly.
just kind of
Mhm.
tell the brain, like, okay, I have this cue. We need to go.
Yeah.
Right.
Yeah.
So, yeah, stop blowing your nose while you go pee.
Yes.
Yeah. I just thought that was a very interesting tidbit. I'll be sitting there and I'll think to blow my nose and I'll say, Courtney told me
Yeah.
I can't blow my nose right now.
It's like I'm coming out of the ceiling.
What would Courtney say?
Is this on Instagram?
Yeah.
Oh my gosh,
think
I'm
we
gonna
made
have
a
to
reel.
share it.
Yeah, I think we made a reel about it. It's been a couple months now, I think.
Oh,
I
that's
wanna say.
awesome.
Maybe that's where I saw it, but I thought I had a conversation with you about it too.
I mean, probably I talk
Yeah.
about it a lot.
Is there was there a time frame that you became very passionate about this in women's health?
I was kind of passionate about it when I started physical therapy school.
Yes. Yeah.
And then I just didn't really know which way I wanted to go. And then when I was pregnant with my daughter and my first kid, I went to pelvic floor therapy, and it was like life changing. They did some internal work and it just really released everything, and I felt really, really good. And then I did a little bit afterwards, and then again, my first one, I'm 26. I
Yeah.
am like, I'm limber and I'm good. And
Yeah.
like, I go back to running, and I made it through to my second one. And then that emergency C-section just kind of changed my outlook on a lot of things.
Sure.
And my recovery was different.
Oh yeah.
Yeah, 'cause
And
you had
yeah.
external things to heal.
yes, and it's 7 layers.
Ooh.
So it's 7 layers of tissue that they go through to get to your uterus's layer 7.
Oh my
And
goodness.
so there's so much healing, and there's so
Oh.
many things to go into it, let alone the mental and the emotional pieces,
Yes.
and trying to care for an infant and a 2-year-old and all the things. And so it really took me a while to get back to exercise.
Yeah.
And when I started, I was peeing my pants and I felt horrible. Like
Yeah.
everything just felt bad.
Yeah.
And so I went back to pelvic floor therapy for a little bit. And then I was just like, something is just missing. And like, nothing against that therapist or anything like that. I was just like, there's more.
Yeah.
There's more going on here. And just through my own experience and like understanding what that was, I was like, okay, I got to get into it. So I took a course and I loved it.
Yeah.
And I started to slowly treat it. And then I didn't really like the healthcare system. And so I decided to go off on my own and just be really loud and really passionate about women's health. And
I love
that's
it.
kind of how it
Yeah.
sparked. And so I just believe that women deserve good care
Yeah.
and deserve to understand their bodies and how they can recover, because everyone's recovery is different. Everybody's journey is different.
Yeah.
And that needs to be respected and that needs to be heard.
Yeah.
So
Well, thank you.
yeah,
Thank you. Thank you.
yeah,
Truly.
yeah.
What advice would you give women in their 30s who are like, I'm in good shape, I'm young, I don't need to worry about this pelvic floor stuff?
Coming.
Yeah, and I want to add to that too. I think in their 30s, especially if they're having kids, they put themselves last.
Yeah.
And
Oh,
I
yeah.
think the biggest
Mhm.
piece of advice is put yourself first.
Mhm.
And that seems scary and that seems
Mhm.
countercultural
Mhm.
and that seems like you're the worst parent because you're choosing
Yeah.
to take care of you. But if you're not taking care of you, you can't take care of your kids well. You can't treat your husband well. You can't have good friendships because you're not doing well.
Yeah.
And so I would say get the pelvic floor exam, whether you feel crappy or not, whether you're feeling super good. It can be very preventative because you don't actually know how your pelvic floor is feeling. If you don't have kids, I think it's good to still get it checked out. I think it is so vital on what it does for us and how it can affect hips and back and everything like that. And just really making sure we're not overactivating or underactivating or anything like that. Especially if you're symptomatic,
Yeah.
for sure. And it adds up. And I know I'm 32 and I know that I'm not in my 40s or my 50s yet, but I know how I feel now compared to when I was 26. 6 years is a big there's a difference. And especially after two different kinds of deliveries, there's a difference.
Yeah.
And so it's going to continue to add up. And the more that we train our brain in one way, the harder it is to be able to get it out of that.
Yes.
And so
Yeah.
if you are just like any other habit, if you keep doing something over and over and over again, your body's going to adapt.
Yeah.
And it might not always adapt in the best way. And so you a lot of people come to me in perimenopause or now they're empty nesters and they're like, I have never had this problem. Like now I'm going through menopause. This is all coming out. And it's like, oops, sorry. One of the things is like, well, it's been adding up
Mhm.
and we're going through a big life transition now. And you probably have ignored it for a long time because you've been caring for kids and doing other
Mhm.
things.
Mhm.
Or you thought that you were young and it wasn't going to bother you or last forever. And so just knowing that things don't go away and they just keep building on each other. So the sooner you get in, the sooner you get checked out, the
Yeah.
better long term it's going to be
Yeah.
for sure. Mhm.
Awesome.
Yeah.
What what advice would you give women in menopause? Like they've already gone through perimenopause.
Mhm.
Why is it so vital for that group of people to
Get checked out,
get
do
checked
all the
out?
things. Um, there's obviously a lot of changes that people go through in that phase of life. There's hormone changes. A lot of times, just like you're going into empty nester, becoming an empty nester, which I know you're very happy about, but that can be really hard for people.
Yeah.
And that can be a process of grief. And I think that's important to understand and how that grief can affect your stress. It can help your coping, can help your muscle healing, those kind of things. I think too with hormone changes, we see a lot of lack of sleep and loss of sleep.
Mhm.
And that's going to affect your healing and that's going to affect just your overall capacity to function, right? And then two hormone changes just in general that affects the how the body functions. It affects dryness and lubrication within the vaginal area, which is in my wheelhouse. We recommend that stuff a lot. But you have muscle changes, you have activation changes, those kind of things. Sometimes we get weaker.
Yeah.
And just like a biceps muscle or quads, if you don't use it, you lose it, right?
Yeah.
And so being able to stay on top of those things and making sure that we're building strength or building coordination is all super important. And this is not my wheelhouse, but hormone testing is huge.
Yeah.
Yeah.
And really understanding what's going on there, but also understanding that hormone replacement is not the only answer. And really diving into the whole breadth of what's happening in your life, what's happening in your career. Do you like your career? I mean, I think too, people get to their mid 40s and 50s and they're like, I don't really love what I'm doing anymore, but I'm already at this point. What do I do
Mhm.
now? And I know you're living it. You're doing it, which is
Yep.
amazing. And not everybody will though. But that all of those things play into the way that your body feels. And so just really taking into consideration all of those things, trauma from the past that hasn't been dealt with. And I think
Yeah.
too, education around pelvic floor and hormones and everything hadn't been big until the
Yeah.
last couple years. And so I feel like women in your generation have been kind of gypped.
Yeah.
And you guys are mixed with this, like my grandma wouldn't talk about
Yeah.
sex and told me
Yeah.
this is how it's going to be, with this younger generation coming up, like take care of yourself, be
Yeah.
healthy, do
Yeah.
all those things. So you guys are kind of in this like
Yeah.
weird universe of trying to figure out what's best and what
Yeah.
makes the most sense.
Yeah.
Correct me if I'm wrong,
Yeah.
but I feel like that's kind of where you guys are at. And
Oh,
it's
yeah.
just like educate yourself and understand and ask the questions, and find a provider that you trust.
Yeah.
I think that's also really big too, is we refer a lot, and I hate when people tell me, like, "You need to see this kind of person," they send me to Google to, like, find this provider, and it's like,
Mhm.
find a provider you trust and ask them who
Yes.
they would recommend,
Yes.
because if they're doing their due diligence, they have all those people.
That's right.
And
Yeah.
Mhm.
hopefully you trust that person, so
Yep.
you should trust who you're being referred to.
Yeah. Yeah.
One of the things that I appreciate about you is your growth mindset and how you partner with other people
Yeah.
and you don't look at other people as competition.
No.
You bring everybody along with you
Mhm.
to help others, and I love that.
Yeah,
Yeah.
thank you. I think I mean, it's pigeonhole. It's not just about us, it's about the
Yeah.
clients. And if
Yes.
we can't bring
Yeah.
around other people, I mean, we cannot see everybody.
Yeah.
Like I can't even touch everybody,
Yeah.
you know? And so we're not doing our due diligence in healthcare if we're not bringing other people along
Yeah.
with us and sending us off. I would rather quote unquote lose a client and have them get better in the realm that they're supposed to be in and have them come to me and say, "Thank you for sending me on.
Yes.
I know I did my job then."
Yeah.
Because even though at the end of the day my business isn't getting that money,
Mhm.
what's most important is that my client got better.
Yeah.
Yeah.
And when
Yeah.
we can have that mindset, everybody wins.
Exactly.
And unfortunately, that's just not the case with everybody. And I wish it was.
Yeah.
But that's why I'm saying find your provider that you trust and ask them who they recommend because hopefully they have that mindset
Yeah.
as well.
Yeah.
So
Yeah.
I would love to I can't treat everybody. I'm not the person for everybody. But I do take pride in knowing a lot of providers in
Yeah.
the area. So if anybody has questions, I would love to even just jump on a call. Let me
Yeah.
know what's going on. This is who I'd recommend.
Yeah.
So
Yeah.
yeah, absolutely.
Yeah. Well, and even now more than ever, you have to advocate for yourself.
Yes.
You
Totally.
have to advocate for yourself. My parents are still young,
Yeah.
but they're not computer savvy whatsoever.
Yes.
They want to talk to people on the phone.
I want to talk to
E- e-
somebody.
exactly.
Yeah.
And so, my mom was referred to someone, and she has not received the care that she should be receiving
Okay.
by any means.
Yeah. No, sorry.
And oh my goodness, it has pissed me off,
Oh, I bet.
you know. And the last time that she called, and I'm sharing this experience because I know this is the experience for many people, but also for our elders.
Yeah.
Okay.
Yeah.
And the nurse kept saying, "Well, you need to go into your portal, Julie. You need to go into your portal." And my mom said, "I don't want to use the portal.
Yeah.
I want to talk to my doctor.
Yep.
I want to talk to the nurse because I have questions." That's all it took for me. And
Yeah.
I have friends in the healthcare. And I said, "Mom, we're going to interview some different people."
Totally.
We are interviewing them.
Yeah.
We're not going in and you're going to,
Diagnosis or anything.
exactly. We are going to interview them.
Yes.
Yeah.
Yeah.
And again, you have to advocate for yourself.
Totally.
You
Yeah.
do.
And I think this could be another full episode about the
Yeah.
healthcare system and advocating. And it's just so swamped. And
It is.
it's unfortunate because there's some really good ones stuck in a system
Oh my
that they
gosh,
just
yeah.
don't have any way out.
No,
But that's
no,
where it's like
no,
people are going to private pay, and that's really hard too. But it's like
no.
you get what you pay for and you get what system you get
It's
into.
true.
And so it
It's
just
true.
is very much like you got to find who has the time,
Mhm,
who's willing to sit down and dig
mhm.
to find the root cause
Yeah.
until you're blue in the face, right?
Yeah.
And
Yeah.
it's kind of
Yeah.
what it comes down to,
Yeah.
you know?
And remember too that these are humans.
Mm-hmm.
They're not a number.
No,
And again, it's been very eye-opening for me and being on the journey with my parents and
totally.
some of their health issues.
Yeah.
And, right down to my dad being in the hospital after his heart attack, and a nurse come in, and she was young and literally talked to him like he was a baby.
Mm-hmm.
And I thought, oh, hell no.
Yeah.
So,
I don't see your dad putting up with that.
well,
It's hard. It's hard when you are you're the patient
it is.
and you're not fully educated
Exactly.
to know.
Exactly. And my mom was on vacation. So I just asked her to kindly step outside, and I said, "We will no longer talk to my dad like he's an infant."
Yeah. Yeah.
And she looked at me and she apologized.
Yeah.
And I said, "He's not deaf
Yeah.
because that is how you are talking to him also.
Yes.
But you're also talking to him like he's a child."
Yeah. Yeah.
And there was no more of that.
Did she pick it up?
Oh, yes, she picked it up.
That's
Because
great.
if she was not picking it up, old Mama
She
Bird
out.
here was going to be laying it down.
Yeah. It's crazy though. But not
On
everybody.
your next career, you could be someone that goes with elderly people to their appointments.
Totally.
I would too. I love me, my seasoned people.
Totally. For me, it's our pregnant mamas. And it's just like, you
Yeah.
don't want that in your birth plan. You want this. Like,
Yeah.
we need to be safe. But I joke with some of my patients, like, if
Yeah.
you want me to come in there and advocate for you, you just call me.
Yes.
Like, I will be there.
Yes.
I will tell them, no,
Yeah.
you are not going to speak that way. You're not going to
Yeah.
do this because pregnant women get treated just like that.
Yes.
It's horrible.
Yes.
Yeah.
And you know what? And she was very receptive. And
Which is great.
She really was. And she apologized. And I was very kind.
Yeah.
I really was.
You didn't come guns a blazing.
No. She just wasn't aware.
Yes.
She was not aware.
Yes.
And, but it was,
It's hard.
it is hard.
It is. And then if
It
people
is
don't
hard.
say anything,
Mhm.
then they just keep doing the same behavior.
Exactly.
Yes.
Yes.
Exactly.
Well, we could sit here literally and
I
talk
know,
all day, but
yeah.
you know,
All day.
you have to go see patients.
I do have to go get in some vaginas and buttholes
Yes,
today.
yes, yes,
so-
yes.
Can't wait. I'm excited about it. Really good.
Oh my
If
gosh.
I lose excitement, you have to. You have to be weird about it, or else it gets
Yes.
weird.
And
Yes.
humor,
Like weird
and
in the
have
way
humor.
of nasty.
Yes.
and have
but
humor.
I'm sorry, but the word butthole is always funny.
Yeah.
I giggle every time. I don't know what it is about that word, but I just think butthole is so funny.
Make me laugh too, though.
Oh,
Words
totally.
make me laugh too. Yes, and we do have to go, but I have 2 girlfriends that were delivery nurses.
Okay.
You know, and and they've done it for many, many years.
Yes.
And the stories, as I'm sure you do too.
It's nuts.
It is.
It's
like
so nutty.
y'all need to have your own podcast.
Yeah. I mean, it's nutty. Some of it gets really serious and really heavy.
Yes,
Yeah.
yes,
And then, but
yes.
you have to laugh at when you're in someone's butthole and they fart or they queef or like, I mean, what you can't do anything about it. And if you
Yes.
don't laugh about it, you're gonna be grossed out and you don't want to keep coming back.
No,
So,
exactly.
yeah. One of my very, very first vaginal exams,
Yeah.
it was in COVID. It was during COVID. And on our shelf, like I was getting ready, put my gloves on, had my patient all ready, and on our shelf we had like all the lube and the hand sanitizers and everything like that. And
Mm.
I went over there, did a little pump, got it all over my finger, and then I got going and I inserted
Oh,
to
you
my
told me this.
patient. And I looked at her and I always just asked, like, how are you doing? Like, whatever.
Yes.
And she goes, I'm fine, but it's like really burning.
Oh,
And I was
no.
like, oh shit, why are you burning? And so I look over at the desk and I was like, fuck, I just put hand sanitizer on my finger and I put it in her vagina and she is just burning out of her mind. And we laughed for so long, for many visits to come. She kept coming back to me.
She's like, I want to see the bottle that you picked up.
Yes. Bless her heart. I like had to separate these bottles now. We were never going back to that. I felt so mortified. I was like, do I just lie to her real quick and be like, I don't know why you're burning. Your vagina must
But it was
be
clean.
weird." It was very clean, very squeaky clean.
Yeah.
I had to then clean it out for her.
Yes.
And then we started over the lubricant and we were golden.
Yeah.
But I laughed about that forever. I will never forget.
Oh my gosh.
Never
Yeah.
forget.
Oh,
There's a reason the bottle says external use only.
Yeah.
Yeah.
Oh, that's awesome. That's a high note, literally, to end on.
Yes. Yes. Never
Yes,
forget
for
her.
all of you who use lubrication in your services, keep the hand sanitizer
Away.
Yes.
in a different spot of the room.
We keep our box underneath our bed of our goodies. And I
Okay.
will never forget the time that Mateo came out and had my whip. It was like a little, it had the whip in the end and then the feather on the other side. And he had gotten in underneath the bed
How
and
old is
came
he?
out with it. Oh, he was like 3 or 4.
And he was just whipping
Oh
it
my
around.
God. Oh, Jeremy and I laughed and laughed and
Oh my
laughed.
gosh.
And I'm just like,
Did he have a cowboy hat on?
no,
Handcuffs.
no, but no, Jeremy, I've never seen him move so fast. He like jumped up, ripped it out of his hand.
Oh,
I mean, and again, we shouldn't shame.
I know. But he probably felt a little bit of shame, like my 3-year-old has my sex toy. What am I teaching my 3-year-old?
Well, thank goodness he didn't put on the cat mask to go with it.
Oh God. Thank you guys for having me.
Yes, thank you.
Yes.
Your Sastastic Life is produced by Apex Creative. Go to apexcreative.vip. That's APEXX creative.vip.